Burnout is a big challenge for people in the helping profession, especially in mental health, humanitarian work, social work, nursing, any profession, teaching, where you're really working with people's intimate life, where you're working with trauma. There can certainly be vicarious trauma when you're dealing with people who have undergone a lot of difficult experiences or trauma. So I think the way to prevent burnout is a few things. One, to be aware that it's happening. Because I think that in my experience with a lot of mental health people and even educators, they don't quite realize that it's happening and they think that they can push through it. And that actually sometimes exacerbates the burnout. So it's really being honest with yourself. When you're experiencing the fatigue, I think signs and symptoms come up like, wanting to avoid the work, feeling very tired after, feeling drained, feeling irritable. And I think it's very important to be honest about that and to check in with yourself. Because if you're feeling that, the awareness of the feeling, I think, is the first thing to be real about. But then how to address it, I think sometimes people need to take breaks, they need to cut down on their work, they need to take vacations, they need to do physical activity, yoga, meditation certainly helps. But I also think switching up populations, sometimes you may need to take another job, you may need to move it from one agency to another, cut down on your caseload, making changes. But I think the most important thing is to really be honest with yourself that you're experiencing it. And I think a lot of people sometimes are afraid to be honest about it because they think that means that it's the end of the road for them. But I think that it's inevitable to happen. It's only human. So I think it's being aware of it and trying to take action to ameliorate that.